Unfortunately, we know that there's a bit of an intergenerational kind of impact of mental illness across families. We know that their children are more likely to develop a mental illness. We know that there are numerous circumstances around the family that kind of strip them of the resources to fully thrive. And so what we try to do is to work out how we can counteract some of those mechanisms, how we can design interventions, if you like, and how we can reduce or even ameliorate the impact of mental illness across generations. My background actually is in psychology and also neuroscience. I've had a long history, I guess, of looking at the issues that people face living with a mental illness. And so I've had the joy, I guess, for the last 5 to 10 years to work on a number of research projects where we have been able to design some programs that actually strengthen the way people feel about their parenting role, strengthen their confidence and help them to better support their children. The last project that I have been involved with is actually just about to begin, where we've been looking at what we call a field called implementation science. This is where we look at how do we translate research into practice. That sort of field is a relatively new field. It's called implementation science. It's about how do we help what we know is best practice, if you like, to be delivered in everyday treatment. So if you're interested in knowing a bit more about how we can better support families where a parent has a mental illness, please consider coming to do a PhD with me. I work as part of a team at the Monash Rural Health School. We have a number of collaborators as well that work on similar projects as well. So coming to do a PhD with me also kind of means coming to do a PhD with a team of international friends, really.